Thank you, President D'Annunzio and trustees. Let me begin by thanking our teachers, support staff, and administrators for all of their efforts in providing the best distance learning program we can for our students and families. I also want to thank our students and families for their positive engagement with our teachers, with Canvas, our learning management system, and learning in this virtual environment. We're committed as public health conditions and safety guidelines evolve to sharing information, considerations, and decisions in a proactive and transparent way. To this end, we continue to offer these regular presentations to the board, updating you on our COVID-19 response. Next slide, please. I've discussed our 6 guiding principles for distance learning over a number of board presentations. These principles have reliably informed the development and implementation of our program and decision-making. Tonight's presentation focuses on the principles of continuity and compatibility as regards our phased return to campus plan, and on the principles of access and equity as we first address the students with the most urgent learning needs. Next slide, please, and let me turn the presentation over to Associate Superintendent of Student Support Services, Laura Juanitas.
Thank you, Dr. Bose, and good evening, trustees. I want to begin by providing the framework for how DJUSD has made and will continue to make decisions related to serving students. First, as a district, we do not control all the factors when it comes to taking steps to return to campus. The governor, the California Department of Public Health, and the Yolo County Public Health Department will continue to make decisions regarding which sectors of the state and our county can safely reopen. This includes their having the ultimate say of whether our schools are allowed to reopen. Secondly, when reopening, we need to evaluate our preparedness to limit the risks of COVID-19 exposure and to provide a safe school environment. In addition, we have to consider the willingness of staff to return and for parents to feel comfortable sending their children to school. For example, if we move too quickly, we could have thousands of families unwilling to return, or has been seen in other states, having staff not feel safe when told they must return to in-person instruction. Lastly, we must always keep in mind who we are serving. We know that although distance learning has difficulties for every student, sometimes it's academic, sometimes it's socio-emotional, but there is a subset of students who are not able to adequately access their education through distance learning. This could be our very youngest students served through the Valley Oak Special Education Preschool. It could be our TK and kinder students who are not developmentally equipped to spend considerable time in Zoom meetings. But it can also be our students who may be older, but are new English learners, or they are students facing homelessness or housing insecurity, which does not give them a stable environment to access online coursework. It's important that we keep all 3 of these considerations in mind as we discuss how to safely return to school. Next slide, please. This is the phased return to campus that we rolled out in early summer when much of the county, state, and national data on the pandemic was still unknown. At that time, I think we were hopeful of a vaccine by fall, or at a minimum that the number of infections in our area would have shown a considerable decline. Remember, early summer was when we were seeing a precipitous drop in infections in Asia and Europe, and we were hopeful that this would be the trajectory in the United States. With that backdrop, we outlined a phased return, which had us initially in full distance learning. The plan was that we could move into phase 2 with county approval for very small groups returning to campus, maybe for limited days or limited hours. Phase 3 is considered the beginning of a hybrid model, which allowed more students to return to classes for limited hours or limited days per week. The assumption was that even if we decided to offer a return for some students, there would be other families who requested their children stay in full distance learning. Phase 4 is a widespread return of most students having in-person instruction a few days a week while still continuing with distance learning on other days. We assume that in phase 4, we would still have families who are not comfortable returning to in-person instruction, and we would need to have flexible leave opportunities and employee protections for staff who could not return to the classroom. During phase 4, we would continue to provide a full distance learning option. Lastly, phase 5 could occur at a point where there is widespread immunity in the county. Next slide, please. Keeping in mind our framework for making decisions based on health, staff and students' willingness and ability to return, and serving our most vulnerable students, I will provide you with the current county and state health information. I'll also give you an overview of the safety plans we have in place to protect the health of staff and students. And lastly, I'll present options for providing services and education to our students with the most urgent needs. Next slide, please. On August 31st, Governor Newsom released the Blueprint for a Safer Economy that uses 2 factors to decide where the county is in the reopening process. Yolo County was placed in the most restrictive purple tier, which indicates that the virus is widespread in the county, with more than 7 cases on average per week per 100,000 residents, or more than 8% on average per week of positive test results. Schools in the purple tier are not permitted to reopen for school-wide in-person instruction unless they receive a waiver from their local health department for grades kindergarten through 6th. I will provide more information on the waiver process later in the presentation. Schools are allowed to reopen for in-person instruction once the county has been in the substantial or red tier for 14 consecutive days. Schools will have to follow strict reopening guidelines or they run the risk of having to close again. Next slide, please. With the tiered system, as a county in the purple tier, meaning widespread infection, we're required to remain in that tier for at least 21 days before the state will consider moving us to the red tier. We are only allowed to move 1 tier at a time, and the state evaluates the tiers on a weekly basis. As of September 14th, Yolo County had new cases of 7.5 per 100,000, and remember, we must be less than 7 to enter the red tier. And our test positivity rate was 5.8% per 100,000, and we must be less than 8%. Because one of the state measures was in the purple tier, Yolo County had to remain in the purple tier this week. If we move to the red tier, we're required to remain there for 14 consecutive days before we get the go-ahead to begin reopening for in-person instruction. We expect that any transition to bring students back on campus can take a number of weeks, and we would want to make that transition at a natural educational break, such as the quarter or the semester. It's also important to remember that at any time we could possibly need to backtrack our reopening if cases rise, which is what we have seen, unfortunately, across the country, and we will probably see across the state as districts attempt to reopen. Next slide, please. So again, the new tiered system focuses on 2 metrics, the 7-day average of new cases and the test positivity rate. So as of September 13th, we had 31 new cases reported, and the 7-day positivity rate was 7.16%. Looking at our trend graph on the right, you can see that we were at our lowest in late May, early June, and we rose to over 10% in July, and now we seem to be holding fairly steady at 6 to 9% for the past 4 months. It will be important for us to monitor what happens over the next 2 weeks, as we first learn if there was an increase in infections due to Labor Day activities, or if we see a rise in positive cases with the estimated 10,000 UC Davis students returning to town this month. Next slide, please. So again, the framework that we use to make reopening decisions depends on the health data in the county, but it is also balanced with our site safety preparedness and staff and families' readiness to return to in-person instruction. Currently, our preparations have been with staff on our campuses, includes training for all employees on safety measures, such as the importance of social distancing, wearing masks when in the presence of others, increasing hand washing and the use of hand sanitizer, and limiting shared supplies. We have completed a widespread deployment of PPE, such as paper and cloth masks, gloves, hand sanitizer, and signage to remind staff how to avoid the spread of germs and to social distance. Staff are also monitoring each other, which means reminding coworkers to wear their masks, to stand 6 feet apart, and not to congregate in workspaces. Staff were given instructions on how to conduct a daily home health assessment and reminded not to come to work sick. Finally, to limit the numbers of staff on campus, many work from home part of the week. Next slide, please. Also, as part of our preparations, we have implemented contact tracing procedures, which includes having a dedicated email and phone number for staff and parents to report positive or probable cases of COVID-19. A district nurse monitors that number and email, contacts the employee or parent the next business day, and gathers information that will be used to decide the length of quarantine and to assess any exposure to other staff. This information is logged into our data system, and the nurse advises the employee or parent on health issues and protocols related to COVID-19. This can include encouraging them to see their doctor, to get tested, to quarantine for 14 days, or in severe cases to seek medical help immediately. The nurse works closely with the Yolo County Public Health to track cases, and they follow up with the employee or the parent to discuss when they would be allowed back on our campuses. Next slide, please. So before we bring students back to campus, we will also need to provide training lessons assigned through Canvas. These are going to include proper usage of wearing a mask, hand washing instructions, social distancing guidelines. We will need to prepare our campuses and classrooms, which can include deploying additional outdoor hand washing stations, rearranging desks and tables in classrooms so they're 6 feet apart, and increasing signage throughout the campuses. In addition, we will also provide parents with instructions on how to conduct a daily health assessment of their child, including temperature checks before they leave for school. We have detailed procedures for monitoring illness when students are on campus, and this includes using outdoor tent areas that are the place where an ill student would go for a health evaluation and where they would remain until a parent came to take them home. The plan is to limit bringing potentially ill students into school offices where they could infect others. Next slide, please. So as mentioned, the state will not allow widespread in-person instruction until we have been in the red tier for at least 14 consecutive days. However, the state made a carve-out to allow small cohorts of students to return who have exceptional needs and cannot access their education through distance learning. This can include students with significant special education needs, new English learners, or students experiencing homelessness. Now, we're allowed to bring a limited number of students on campus, even when we're in the purple tier, if we follow strict guidelines similar to the daycare guidelines that have been in place all summer. This includes each cohort is limited to 16 students and staff combined, and the group must be isolated from all other groups on campus at recess, at lunch, etc. And the groups must be less than 10% of the school's total enrollment. Next slide, please. So one option for implementing phase 2 would be that in step 1, we begin conducting in-person special education assessments again. The majority of this work stopped in March, and we would want to prioritize initial assessments and also finish the ones that were partially completed last March. A full special education assessment can take 8 to 10 hours or more, but it would not require the student to continue coming on campus week after week. So in order to balance safety with the need to complete these assessments, we likely would centralize them at a few sites. We would set up spaces in larger classrooms instead of small offices. We would limit the number of each staff person would conduct each week. And because we're only staffing at a few sites, we could have a nurse present to take student temperatures and assess for illness before they enter the building. In order to verify that having students on campus continues to be safe, the plan would be that we would remain in step 1 for at least 2 weeks. If everything went well and we worked out any of the kinks, we would then consider moving to step 2, where we could serve students on campus who receive specialized services that are part of their special education IEP. Examples of this could be physical therapy, occupational therapy, speech language therapy, or mental health services. Again, we would continue to centralize these at a few sites. We'd utilize large open spaces, limit the number of staff contacts per week, provide a nurse to assess students and staff for illness, and we would add additional PPE as required. So for example, a physical therapist might wear a surgical gown, a surgical mask, and a face shield when working closely with students. Both steps 1 and step 2 require students to come to campus for brief periods of time and usually only once per week. We would continue to monitor illness both in the county and at school while we remain in step 2 for another few weeks. If all continues to function well in step 1 and step 2, we could consider opening a few small, stable cohorts. An example of this could be a special day class for students receiving a high level of special education services, or providing a space on campus where new English learners could continue their distance learning classes while having tutoring and English language support in person. We would continue a distance learning option for students who prefer not to return to in-person instruction. Next slide, please. So what I discussed in the previous 2 slides is a possible plan for bringing back only students with exceptional needs in phase 2. This is part of the carve-out that the state has allowed, regardless of the tier we are in. Now I'd like to explain how the state's tiered system could interface with the DJUSD phase 3 of in-person instruction, which brings back a much larger number of students. Again, we cannot move into phase 3 until we've been in the red tier, which is still substantial community spread, for at least 14 consecutive days. Reopening will need to be slow, measured response, similar to our process for bringing back students with exceptional needs. Examples could be bringing back TK and Kinder first, or bringing back all elementary students, but maybe only 1 day a week, while continuing with distance learning for the other days. We would continue to offer a full distance learning option for students whose families do not feel ready to return. Any plan we make must take into account the health data from the county, permission from the county and state to reopen, and the confidence of staff and parents that our school sites are prepared and that our contact tracing and testing program are working well. It's a delicate balancing act that must continue to take into account health, safety, and service to our students. We do not want to make the mistakes that we've seen across the country with schools and universities opening up too quickly and soon after having to close because of skyrocketing infection rates. Next slide, please. So as I said, any reopening plan requires complete confidence in our district's contact tracing protocols and testing plans. All of the protocols are currently listed on the district website and apply to both staff and students on campus. The link is provided in this slide. But I'd like to briefly share with you highlights of our protocols as they relate to students. So as stated, we have health screening questions that we will provide parents prior to students returning to campus. The expectation is that the parent will screen their child for symptoms every morning, and if the child has symptoms, for example, such as fever, cough, muscle aches, they are to remain home until symptoms resolve, and they should follow up with their healthcare provider if symptoms continue. If the parent is concerned that their child's symptoms might be COVID related, they are encouraged to contact their healthcare provider or the district nurse for guidance. If a student becomes symptomatic for COVID-19 while at school, they will go to the outdoor health assessment area on campus where they can be evaluated and if needed, wait there until they can be picked up by a parent or guardian. The school nurse will contact the parent afterwards to discuss symptoms and whether the student should be tested for COVID-19. Now, if a report is made that a student lives with or has been in close contact with a person who has tested positive for COVID-19, the school nurse will contact the parent and explain that the student must quarantine, monitor their symptoms, contact their medical provider to arrange testing. And in consultation with Yolo County Public Health Department, the cohort of students and staff who have been in close contact with the student will be notified. All classroom and spaces visited by the student will be thoroughly disinfected. And then if a student or staff member actually tests positive for COVID-19, the cohort of students and staff who have been in close contact with that student will be notified. The cohort will be closed for 14 days from last known exposure and asked to quarantine, monitor symptoms, and arrange testing, either with their medical provider or at the county testing center. All classrooms and spaces used by the cohort will be closed that day and cleaned and disinfected before being used again. Students and staff in the cohort will transition to distance learning for the next 14 days. If more than 5% of a school's student and staff become symptomatic within a 14-day period, the school must close for a period long enough to disinfect the entire campus. And if more than 25% of the schools in the district are closed within a 14-day period, the entire district will be asked to close for a period of time. Next slide, please. So I do want to talk a little bit about the elementary waiver process. While still in the purple or widespread tier, Governor Newsom created a process where districts, private or charter schools can apply through their local health department for a waiver to reopen some elementary schools. The waiver acknowledges the difficulty that young children have with distance learning. One key metric that the waiver calls for is the county's 14-day COVID-19 case rate must be below 200 for 100,000 residents. As of today, we are at 129. Also, according to guidelines laid out by the California Department of Public Health, districts must consult with labor, parent groups, and community-based organizations prior to submitting the application. The plans must include small, stable class sizes, rules for social distancing, protocols for handling outbreaks, plans for testing if there are exposures, and criteria for when to close. The waiver can be granted for an entire district or for a single school or schools within the district. Before granting the waiver, the local health officers must review county epidemiological data and consult with the state health department. So currently, the only schools within Yolo County have been granted a waiver are small, private, and parochial schools. The waiver process for DJUSD would be complex and would require considerable outreach to staff, parents, and the community before we embarked on this process. Next slide, please. So in summary, our roadmap to reopening is not a perfect correlation with the state's tiered system, and it will require a slow, thoughtful progression that balances the Kearney County infection rate with our ability to manage the risk of bringing students back to campus before there is a significant reduction in COVID-19 cases or a vaccine. We must weigh our decisions to serve students and staff with the knowledge that although our teachers are doing an excellent job with distance learning, it is never going to be a substitute for in-person instruction. Next slide. Thank you.
Thank you very much, Ms. Juanitas. Do we have any public comment on this item?
We have one public comment on this item from Julie Vandersweet. Hello. Several schools in Davis and Woodland have been granted waivers and are operating fully in person. I have not heard of any incidences of virus at these schools. Would DJUSD consider speeding up the plan to go back to school? Julie Vandersweet.
Thank you, Superintendent Bose. All right, let's move to trustee comments. Trustee Adams, would you like to start, please?
Actually, I would like to hear from Trustee Poppengate first, just because of his deep knowledge of science.
Sure, absolutely. Trustee Poppengate.
Okay, thanks, Tom. I just want to thank the administration and everybody in the district for really being thoughtful about the reopening process. And I know we asked, I think, the last school board meeting to try and align the state's criteria and our phased criteria for reopening schools. So I really appreciate that attempt. It's not perfect, as Laura mentioned. So I think you did a great job. I guess I just have two questions. Has there been any change, Laura, in terms of the county's stance on testing? Because I think last time you had mentioned that there was really no plan to test asymptomatic people.
Yeah, we have weekly meetings with them, and they are confident that if we had to test a cohort of students, that they could accommodate that, but they are not ramping up plans or not feel like they can where they're testing, 1,500 employees or 8,500 students before we return to class.
Yeah, I still have some problems with that, in terms of whether that's the appropriate approach or whether it's a response to lack of testing capacity. Because, just looking at the UC Davis website, they're going to set up on campus a testing capacity, and, they're wanting to test every student coming back. They're wanting to test asymptomatic students, test on a regular basis. And I guess I wonder why they're looking at it differently than the county. So I'm still concerned. Nothing's changed, but, we hope that maybe the university, as they develop their rapid screening capacity, can also help the city of Davis and our community members in terms of access to testing. The only other question would be, what is going to be the communication between the university and the school district if someone does come up positive in terms of the contact tracing? Is there going to be some communication there so that if a university faculty member that's a parent turns up positive and, they follow with their students and there needs to be quarantining of the family or something like that, how are we going to communicate those types of issues?
Yeah, very good question. Part of the protocol is if we hear of a positive test, we do contact the county, Yolo County, and report that, even if the person says, well, I've gone to my physician, and the physician is also supposed to report. So there should be some correlation with that. And then, so the county would be hearing about that and then could report out to the university.
I assume the university would have to report to the county, correct? And then
that's the protocol, yes.
Yeah. And that's how the information would then be distributed to a school district, for example. Yeah. Okay.
And that already, I think, happened quite a bit last spring. There were the first positive cases in Davis really were UC Davis connected. And I know the health department was in regular close contact with them. They didn't interface with any of our parents and students, but if they did, that's why we report even probable cases directly to the health department so that they've got more data than they even need, so we can make sure something doesn't get missed.
Okay, well, those are the two main questions I had.
Thank you, Trustee Papengay. All right, Trustee Adams, would you like to follow that?
Sure, and thanks for asking those questions. Mine are kind of small. Just one on the waiver process. Is it by school or by education agency?
It can be both. An entire district could go for a waiver for all of their elementary schools, or it could be one campus, two campuses, three campuses. You have to meet the criteria that the county lays out.
And it's elementary because the assumption is that the COVID-19 does not spread as rapidly, or does?
Well, I'd say it's twofold. It's that, again, it's all new research, and you've all read, like I have, there is some contradicting, but the idea that under the age of 10, there is less transmission. Doesn't mean they can't transmit, but there is evidence that there is less transmission if a child's under 10. And it's also recognition that very young students are, developmentally going to have much more difficulty with distance learning. So again, it's the balancing act that the state has allowed, just like we're trying to balance risk and benefit. The state has done the same.
Okay, thank you. That's good to know. So, I mean, my point is then on that is, even among our youngest students, they can get infected and they could actually be a source of disease infection, right? They can be spreaders.
Definitely.
Yeah, so, okay. The other is the role of outdoor learning or the use of outdoor facilities as we gradually open up or accept people come on the campus. What could you explain what the role of outdoor facilities would be and using outdoor spaces differently?
I think a lot of that depends on exactly who's being brought back and the timing. I mean, obviously we know in this with these fires, there wouldn't have been outdoor learning. We wouldn't have been able to do that. Soon we might have other weather issues. Everything I have been told and in research is, yes, outdoor learning has benefits, but also it's the distance. It's the smaller class sizes. Wearing masks can never be underestimated as hugely important. And having, not having classrooms that are filled to capacity, but having smaller cohorts there. And that would allow us to be safely indoors.
Okay. So even if we did outdoor learning, it still requires masks and still requires all the same safety protocols. You might be able to hold, it might be a safer place in some of our indoor spaces.
I think maybe. I think it
just
really
because
depends.
of air circulation and things like that. Right.
But we did upgrade our air filters in our classrooms. So that has also been done over the summer and has, I think, been completed.
That is actually to be completed. Thank you.
All right. Okay, thank you. That's all I have.
Okay, thank you, Trustee Adams. Trustee Fernandez.
Going back to the waiver scenario. So a waiver is needed when, for some very specific and discrete types of, student populations, right? And that waiver is, you submit that both to the state and to the locals?
You submit it to Yolo County, but they can't approve it without consultation with the state.
Okay.
Go ahead.
Oh, and Yolo County who? Like the
Yolo County Public Health Department are the ones that would grant it.
They actually approve. And then is the same process, because also too, you had made a statement that going back outside of the waiver process, but then going back down to one of, in one of the phases, like for the hybrid approach, that too needs both state and local approval?
Well, it needs to be that we're in the red tier, and the state is the one that places us in the tiers. So once the state places us in the red tier, which is, the second to the highest, that puts us, we have to be there for 14 consecutive days, because it's probably pretty common that you might bounce back and forth between red and purple. So we'd have to be in red for 14 consecutive days. And then that automatically triggers us being able to start a reopening process. So you don't need a separate application once you've been there.
Okay, and but then the reopening process, though, was that still also need the ultimate sort of sign off or approval of public health, or is it like a more of a in consultation with kind of thing?
Yeah, if we're in the red tier, we've been there for 14 days, then it's in consultation with. We would run our, and we already do this, our plans by them so that they can give approval, but we would be allowed once we're in the red tier. And there are some counties north of us that are in the red tier and will be doing that in the next few weeks. Okay.
And I'm always curious, I think I might have mentioned it last time, I'm always curious kind of what our, colleague districts are doing. Are other, to the extent we know, are other districts that are doing in person for these student populations for whom waivers are available?
Well, definitely for the carve out, the beginning special education assessments, bringing students back for services, these small cohorts, all the districts in the county are looking at that right now, making plans, and are probably on a similar timeline as us.
Okay, but so no one's really sort of out ahead of us or behind us necessarily. We're all seemingly kind of in the same spot, is at least as it relates to the entire county.
Yes, with the public schools.
Yeah,
definitely. Yeah, we have meetings all the time, and we are constantly checking with each other and are fairly in sync with how we're progressing.
And then what about communication do we have with the daycares in our community and the private schools as far as what they're doing? Is there any kind of formal communication with them just to inform us of what they're doing?
The private schools were on the Yolo County task force that I was on with Dr. Bose and Dr. Boonshoy. They were on that as well. And when we have our regular weekly meetings with the health department, the private schools are on there. They have a different set of stressors, and they tend to be small for the most part. So the ones that have elementary programs, I think definitely we're going the route of approval through the waiver process, which has nothing to do with being in the purple or the red tier. You can go for the waiver process when you want.
And then the last question I have, is there's a lot of talk in the media about a potential vaccine on the horizon. And so, and I know that there's not any real clarity as to when that would be, available and then actually, accessible, to use those two terms. Has there been any discussion in the task force group about that? Because I just think that if, to the extent, there's a lot of communication in the public sphere generally that a vaccine is available, I think there's going to be a lot of not necessarily pressure, but communications from our parent community as to what our plan is, relating to a vaccine. And so does the completion of a vaccine and its accessibility, are there standards in place or protocols for the timing of that and how that may affect our tiers?
Yeah, I'm actually glad you asked that question. I'm also working with the Yolo County Office of Emergency Operations, who is close to the health department, but slightly different. We're actually going to, and the communication will be coming out soon, on October 17th, which is a Saturday, we're going to be hosting a drive-through vaccine clinic for the flu shot. And the idea is to give, they would love to give 2,000 plus doses of the flu vaccine. And the reason we're doing that, and we're doing it in conjunction with them, is they want to work out all the kinks of what a massive vaccine effort would look like. And if we had the COVID vaccine, they're already making plans where they would potentially on one weekend stand up 4 different school sites in Davis, some in Woodland, West Sac, and do mass inoculation. So they're already planning that. We're working with them. Our nurses, we've actually got, I think most of the nurses are actually going to be helping at that clinic and giving the flu shots. We know that that's going to be important. And there's also a lot of talk about teachers and school staff being pretty much in the first responder criteria that we know schools need to reopen and we need staff to be safe. And so right behind doing the hospitals and the fire departments and the EMTs would be schools. So the county is already part of a very wide, statewide and really nationwide emergency effort practicing these policies so that they could give 60,000 doses of a vaccine in a weekend.
Okay, great. Thanks for that. No other questions.
Thank you, Trustee Fernandez. I have a couple of questions before we turn it over to our student representatives for their questions. Back to the three steps of looking at, serving populations early, even before we, move out of purple and separate from the waiver. You mentioned, looking at the assessments, the IEP assessments first, and then potentially moving to some specialized services that are very difficult to deliver in a distance way, or that have populations of students that we serve that, it's not compatible with. What kind of time are we talking about, moving to that first step of beginning to do those assessments? Do we have a sense of when that will begin?
I think a lot of it will be based on your direction tonight. That's the direction we would go. We know it's going to take a few weeks, couple weeks probably, to get all the things in place. First of all, to start with the assessments, we have staff that are ready and willing and want to get started, but we want to do this right, and we want to make sure we have all the unintended consequences, all the PPE, everything set up in a way that we're not going to see any kind of rise in infection rates. So we really do feel like the first step may take the longest because we just need to have a lot of things in line. Again, same with, labor and, all our safety procedures. And then I think we really can, after that, I think probably on a 2-week process, assuming things are continuing to go the way we want to go. And again, that we're not seeing a surge in the county. We saw a surge the July 4th weekend, and I think we're understandably nervous that there could be a Labor Day surge. And frankly, even more that with the university reopening, that there could be a surge. So we want to get through this period. It's a 10 to 14 day lag. So if the dorms opened up last weekend, we'll see what things are looking like in a couple weeks, make sure that the numbers are continuing to go down. Because you could see when I showed that trend graph, although they're down now, we tend to go kind of up and down over the last few months.
Sure.
So want to make sure.
Oh, I'm sorry.
No, go ahead.
Yeah, so that would affect, whether in purple or red, but does that also affect our thinking as a district about beginning to serve these, the populations that are at greatest risk at taking this first step of doing the assessments? So if, for example, if the rate climbs because of whatever exogenous things are happening, would that, reduce our willingness to move forward with this first step of beginning the assessments?
I don't think so, but it just means we have to really keep that in mind. And that's why, since we're starting small, which I am a firm believer in starting small, we'll have nurses there at every school site that's happening. Once we have all 16 school sites opened, we don't have 16 medical professionals. Right. So, but we do now. We do when we start small. And it's similar to my philosophy over the summer. A lot of these contact tracing procedures and protocols were developed over the summer, even when we didn't have that many staff working, but it was a good practice. And I know I learned a lot with how the health department works and the kind of information they want, so that when the nurses came back right around when school started, I could train them, and I'd already learned some of the do's and don'ts, and then we were ready to roll. And the nurses have been doing contact tracing now for the last 3 weeks. They're comfortable with it. They're confident with it. We're consistent, which is hugely important that we're consistent across the district. And so I do feel we're ready for this next step, but we just have to be careful and do it right. do not want us to be in the position where we're coming back so fast that it just doesn't work well. And then people lose confidence. I want people to continue to have that confidence in how we're handling things.
Mm-hmm. Okay, so if the district decided, tomorrow that we wanted to begin to move towards a thoughtful and cautious approach to that first step, am I right in hearing that it's somewhere in the neighborhood of 2 weeks before we'd be able to implement it?
Yeah, I would say at least. It could be longer. I think we just have to see how everything plays out. But that would be the idea. Definitely would not be any less than 2 weeks.
Okay.
Yeah, I just want to add it could likely be more like 3 to 4 weeks. We would love to be able to do it in 2. But there are just a number of levers independent of our direct control that we need to make sure are properly and adequately addressed. So with as much prudent haste and planning as we can.
Okay, thank you for that. I have a follow-up question on that group in step 3. We talk about potentially serving a specific set of cohorts, and you mentioned a couple students that that might be a coherent special ed cohort, might be English learners. It could potentially be students even in secondary that are really struggling with distance learning for a variety of mental health or other reasons. So have we begin to think about who those cohorts are likely to be?
Yes, I think one thing that's been important in our meetings with the health department, we really drilled down with them about do they have a specific group in mind? And they were very clear that that's for districts to decide who needs to come back, but they kept saying over and over again, but you have to keep in mind this carve out of letting people come back is not to bring back large numbers of students. It really is very small cohorts that are not going to interact with each other. So you can imagine at a secondary level, it already becomes incredibly complicated. That's why in many ways, and we are a district of full inclusion. So even within our special education services, those students are in classes, full classes of 25 to 30, and that's not the way this carve out works. Mm-hmm. So that's why, the special day classes are a more of a discrete small group. Sure. And they are some of the kids that are struggling the most. So that is a good start, but definitely we can designate and be creative as we choose, but it's got to be small numbers.
Understood it. And I'm sure we'll do this, but just want to emphasize, and I know that all of us have said this previously, that, that we are open-minded about what it means to be at risk in this environment. Because there are maybe some students that traditionally we wouldn't look in that way, but that are impacted by the current situation. And, obviously we want to serve all of our students well, but the ones that are at highest risk right now are the ones that, I think are really getting our attention.
Definitely.
So a couple other follow-up questions. As we talk about coming back onto campus, we want to keep our teachers and staff safe, obviously. What kind of training have they already or will they receive as they start, preparing to be back on campus? Obviously you've shared, and thank you for allowing us to look through all the protocols and whatnot, but is there going to be active training by our nursing staff, by public health professionals? How are we going to manage that?
Yeah, our nursing staff, when people first came back to work, there were lessons that were mandatory for people, and there was quite a bit on health and safety. And so we will have additional lessons that have to do more when students are there and interacting. The nurses are they've been creating videos, and they're ready and prepared to do training, virtual training or in-person training with staff. So a lot of this, the nurses really are carrying a lot of this. And, you know, in a time where you don't have a nurse for every school, it's challenging, but they're thinking creatively on how to provide the training that teachers need. And we're fielding lots and lots of individual phone calls as people need to talk through what their concerns are.
Okay, thank you for that. And then one final question. Similarly for parents, you know, what you've outlined and what I know a lot of other school districts are looking, there's an important role that parents, guardians are playing in pre-screening and monitoring their children, sharing information when they learn about it. Have we thought about how we provide guidance to our parents to make sure that, you know, they're aware of our expectations of them and that they have, you know, the tools and knowledge that they need?
Yeah, we have quite a bit already up on the website. The idea is going to be to push stuff out to families via the parent broadcast that comes out every month, or a special, you know, communication of when students are coming back. Again, since we're going to be starting small, we have a screening tool already. We have detailed information for parents who would be bringing students for assessments. So we'll be working in those small groups and then scaling that information up.
Okay, well, I'd encourage us, and then, you know, this is staff's purview, but I'd encourage us to think about, you know, some of the lessons we learned. For example, I know it's a very different thing, but I'm going to draw a bit of a stretch and an analog. The training that we gave parents around Canvas, right? And that sort of active engagement, I think certainly we got a lot of feedback from parents that was very helpful, right? We could have given them a little guide and, you know, said, you know, have at it, good luck. But I think the effort we took to, you know, actively engage and have, you know, workshops and then offer those videos, if we think of something like that, you know, consistent with what are delivering our expectations of the protocols, I think it may, you know, be a more compelling and more accessible to more of our families if we take an approach like that.
Yeah, definitely.
Okay, great. All right, well, I'd like to move on to our student representatives. So let's start with Mr. Lee. Questions or comments you have for staff on this topic?
I only had one question. That would be, like, near the end of the year, what would school events like parades, dances, proms, like assemblies, that kind of thing, look like if we were to be in maybe like phase 3 or 4? Because I know that a lot of people are pretty worried about events like graduation or prom being canceled. Will those types of things be able to happen if we were in like the orange range, or maybe would they have to be modified?
A lot of that is going to depend on what the specific health orders are at the time. So right now you can't congregate more than 50 people, and, you know, it's small groups, but those are the kind of things that as we move through the year, we'll certainly be following what the local health orders are. And then again, trying to be very creative so that some of those events can happen. We're certainly hoping that by, you know, April, May, that things will have lessened, but we're just going to have to see. It's very much an unknown.
Okay, thank you.
Thank you, Mr. Lee. Ms. Ortega Nunez, comments, questions for staff?
Yes, I think you might have just mentioned this, but just in case you didn't, I will make the comment. I understand that the reason why parents are the ones that are going to be giving the training to monitor the students before they leave to school is because this is usually or mostly for younger kids. However, when you move to older kids, some parents are not at home while the students are in the morning, and I would recommend giving the training to the students as well, instead of having the parents teaching them in case there's any misunderstandings.
No, excellent suggestion. And our plan is actually to have lessons to students, really all ages, but definitely at the older grades, where it'll be part of your schoolwork through Canvas. It'll be an assignment that things to watch and interactive discussions. So that is definitely a plan, because you're right. A lot of older kids, they may not necessarily see the parent when they're leaving for school, or they're driving themselves to school. So we want young people certainly to also understand how to safeguard their own health.
Great, thank you.
Thank you very much.
Joe, can I just ask one follow-up question?
Oh, yeah.
Laura?
We're not done, Trustee Papagay, but yes, let me thank Ms. Ortega Nunez first. Thank you, Ms.
Oh, okay.
Ortega.
I thought she was done. Sorry.
Yep, no worries. Go ahead, Trustee Papagay.
Oh, this just goes back to the issue of the flu vaccination and how important that is this year. So this community event was just, that was a community-wide vaccination clinic. It was not just anybody that wanted a flu shot was able to get it.
Yeah, it's going to be in October 17th.
Okay.
Yes, and it's absolutely anybody, and you don't need to show insurance or not insurance. And there's even some thought they're not even going to write down people's names. You can just come. They've got adult doses and pediatric doses for kids under the age of 10.
Do they have old people's doses?
They sure do.
I'm in that category, and they don't have it yet at UC Davis. So.
Oh yeah, they will have it, and they have access to like 9,000 doses. So they want as many people as they can, because frankly, they really need to practice how they'll do this when there's a COVID vaccine.
Right. Well, we can't require our students to be vaccinated for the flu, but perhaps as an alternative on our website, we could put a little blurb in there indicating how important it is this year to get an updated flu vaccination.
Definitely. Yes. And the county is putting together a public information campaign that'll be going out through the city of Davis and DJUSD, and I assume the areas around us as well.
UC Davis, they're not going to allow you on campus unless you can prove you've had a flu vaccination. So,
good.
Yeah. Okay, that's it. Thanks, Joe.
Thank you.
Thanks, Trustee Papagay. I'll say, so trustees, staff is seeking direction from us on pursuing with on-campus opportunities for students with urgent learning needs, as they described in this presentation. So I would entertain a motion to that effect, if any of you would like to so move.
I could move that we direct the district to move ahead with plans to reopen camp, or to evaluate students and reopen campus, depending on county and state guidance. I don't know where that's. I'd probably have to think about that a little bit longer to get it more concise, but
I think Laura, correct me if I'm wrong, but I think the guidance in particular that staff is looking for is around those students with urgent learning needs. So the 3-step process that you outline, is that the area that you're most interested in at this time?
Yes, definitely.
So I would move to direct the district to move ahead with their 3-step process for evaluating the students at most risk or requiring the most need.
Okay.
I'll second that.
Okay. Moved by Trustee Papagay, seconded by Trustee Adams. We'll move to a roll call vote. Trustee Adams?
Aye.
Trustee Fernandez?
Aye.
Trustee Papagay?
Aye.
I vote aye as well. So that's 4 in favor, none opposed, and none abstaining. And, behalf of my colleagues, thank you, staff, for a very thoughtful and well-delivered presentation.
Thank you.
All right.